Hi everyone, welcome back to BioTalks. Today we're talking about something that I think a lot of us are seeing play out in real time, not just in a clinical conversations, but on grocery store shelves, and our social media feeds, and in questions patients might be walking in with. Today, protein isn't everything, and fiber is having a major moment. Terms like fibermaxxing are circulating online with millions of views. And somewhere in all of that noise, there are real, clinically relevant conversations worth having. To help us sort through that, we have Dr. Racheal Onah with us today, and today we're going to talk about what's actually driving these trends and what the science supports, and where practitioners should be paying attention. Dr. Onah, thank you so much for being here, and before we jump in, can you just give listeners a quick sense of your background and how you think about the intersection of nutrition trends and clinical practice?
Thank you for the introduction. Just to preface, I am a naturopathic doctor and I do have a practice that is based in pediatrics and family health. And I do think that nutrition plays a really big role in health, especially in clinical practice. And we are seeing a lot of changes and a lot of movement. So I am excited to discuss our topic today. And yeah, looking forward to it.
Great, thank you. So then let's get into it. So let's start with kind of the big picture. Protein is everywhere right now. There's protein chips, protein water even, high protein yogurt, and cereals are advertising protein on the front of their boxes. From a clinical standpoint, what is actually driving this? Is there a legitimate conversation underneath all the marketing?
Yes, so that's a great question. There has been a huge surge of protein in every meal. I've seen it in protein, yogurt. I didn't see this 10 years ago, so it's so interesting now to see it being listed on nearly every single box. But there is a legitimate conversation underneath marketing, and even if the food industry has amplified it dramatically, there is a clinical relevance to it. Protein has several benefits, so it does play a pivotal role in maintaining and building muscle mass. It helps supports recovery from illnesses and also helps with exercise. It also contributes to satiety. So I think that that's probably the biggest driver that I've seen in marketing, is that it does help with making you feel full so that you don't eat as much. And then also it has an important role with aging. So it does help with healthy aging as well. And so low protein intake has been linked to, inactivity, chronic diseases, reduced, muscle mass. And so that's what's led to a great emphasis in an adequate protein intake, especially amongst like older adults, athletes, and then people that are looking for weight loss. And then at the same time, we have seen like a huge interest when it comes to body composition rather than just simply losing weight. And many people that want to lose fat want to preserve their muscle mass. So protein is a key part of that strategy. And then, the rising of like strength training and fitness tracking, and then also GLP-1 use and weight medications, that's also kind of pushed that drive. So there's definitely a lot of information out there that has kind of supported, increasing protein in their dietary intake.
And I think it's pretty good to know in context all these factors going on and not just reading these product labels and trying to guess what that is. So this kind of raises the next question, because the numbers being thrown around vary a lot depending on who you ask and what you're seeing. So how much protein do people actually need? Because the recommendations seem to differ pretty significantly depending on the source, athletic guidelines, and any kind of approach that you're looking at. So how do you help patients kind of make sense of that?
It's interesting because there's no one size fit all when it comes to the number of protein that you're supposed to intake. The recommended daily allowance, which is the minimum amount of protein somebody should be intaking, is 0.8 grams per kilogram per day for adults, and that's like 18 years or older. So this number will change based on your weight. So if you weigh 150 pounds or 68 kilograms, the minimum amount you should be intaking is 54 grams of protein a day. Whereas somebody who is like 200 pounds or like 90 kilograms, they should be eating a minimum of 72 grams of protein a day. And to note, this is the minimum amount that they should be intaking. Usually I do recommend 30 to 40 grams of protein a day to really help with preserving muscle mass, helping with increasing satiety, and other benefits that I mentioned earlier. For athletes, their recommended recommended dose is a lot higher than the regular average population. Usually theirs is 1.2 to 1.6 grams per kilogram every day. And this is because, with intense exercise, they can cause like micro tears in their muscles. They can, protein can also help with the speed of recovery, help maintain and build the muscle mass that they're looking for to improve their, athletic performance. So they typically have an increased amount of protein in their daily intake. So that number does change. So it's not one size fit all, but the minimum amount should be 0.8 grams per kilograms every day.
Yeah, so it sounds like context matters a lot in the situation, especially when patients are making choices based on what products they're advertising rather than what their body actually requires. So, moving on from this, let's shift to another major trend that's gaining a lot of traction right now, which is fiber, and specifically the idea of fibermaxxing. So, fibermaxxing has been all over social media, and the idea is kind of intentionally maximizing daily fiber intake. So for listeners who haven't come across it yet, can you kind of just give us a quick read on what the trend is and whether you think there's an underlying premise?
So fibermaxxing is basically purposely trying to increase your fiber intake to optimize your health, digestion, body composition, and also reduce appetite. The underlying premise of fibermaxxing, it sounds clinically sound because, if you look at the standard American diet, it does not promote fiber at all. So therefore, I do think that, trying to optimize the amount of fiber you're eating daily does have a good premise underlying.
Yeah, and it's kind of interesting because unlike a lot of other wellness trends, this one's kind of pointing towards something that has a lot of substantial research behind it. But the way it gets communicated online doesn't always necessarily reflect that nuance, which leads me to ask about the more practical side of it. So like you mentioned, most people in the US are significantly under consuming fiber. So what does that gap actually look like in practice? And what do you see clinically when people aren't actually getting enough fiber?
That's a really good question as well. I've seen so many GI tests, and it's so funny because when I ask practitioners, what does their diet look like? There is literally no fiber. And I typically see that reflective in the short chain fatty acid section and also their commensal bacteria, because you typically see those levels being extremely low. And so if you're not intaking fiber, usually you do see that basically bacteria help ferment fiber and produce those short chain fatty acids that work as microbial metabolites to help with inflammation and motility. And so if they're not eating fiber, that's going to be quite low. And then fiber also helps feed the beneficial bacteria. So I typically see that quite low if they're not eating enough. And so chronic constipation cases, really and truly, if they start to eat the recommended amount of fiber daily, they typically have a better, bowel movements. They have better markers on their stool test. So that's the one main thing that I have seen, especially working as a medical advisor. In terms of like clinical practice, other things that, I have typically seen is like SIBO. SIBO is a really big one because motility is impacted. It kind of gets stuck in the small intestine. Then it starts to feed those small bacteria in there and leads to that overgrowth. Gut dysbiosis also is very common. Other complaints outside of GI, type 2 diabetes, cardiovascular disease, high cholesterol, weight gain or inability to lose weight. So there are a lot of health concerns that can occur if you're not eating enough fiber on a daily basis.
Yeah, and I think that's pretty evident online. I think a lot of the conversations around fiber specifically are preventing these kinds of surge in what you're talking about, all these like GI cases. So on one end, you have people who are chronically under consuming fiber, and then on the other end, there's people, because of this, they're kind of overcorrecting this possibly. And so for someone who has dramatically ramped up their fiber intake very quickly, what should practitioners and patients actually consuming the fiber know? Like, are there risks for the all-in approach?
I do believe that individuals shouldn't just ramp up their fiber intake, especially if you've gone years consuming a very low level of fiber. I think that it should be gradually introduced and every week maybe increasing by 1 to 2 grams of fiber a day until you reach that minimum 25 grams of fiber a day. The reason being is that rapid jump from a very low to a very high fiber diet can cause bloating, abdominal cramping, discomfort, gas, and it may also lead to like either constipation or diarrhea. So you start to see a lot of IBS symptoms when you start to just ramp up the fiber intake. These are not severe symptoms, but they can cause a lot of discomfort to an individual. And like I said before, I mean, fiber does play a big role with SIBO, but if you already have SIBO and then you start to just reintroduce fiber, you're going to be feeding that bacteria inside the small intestine. So that's another reason why I wouldn't advise. And also the type of fiber that people are intaking, I also try to recommend based on what their health is. So you don't just go from like 0 grams to 25 grams, because you might notice that you're having, bloating, gas, those SIBO-like symptoms, because your gut health isn't in a place where it can sustain 25 grams a day.
And I feel like that's kind of really useful framing to keep in mind, as fiber is one of the things where more is generally better, it sounds like, but the how matters as much as how much. So now I kind of want to bring it back to combining protein and fiber together for a moment, because I think there's a bigger conversation happening here about how people are relating to food in general. So when you zoom out and look at both of these trends together, the protein craze, fibermaxxing, what do you think they're actually reflecting about where people are with their health right now? Is this a positive shift in health literacy, a response to something, or something else completely?
There is a positive shift in the health literacy in response to how to optimize your both micro and macronutrients. People are paying more attention to the food quality and not just the quantity of how much they're eating. And as previously stated, protein helps preserve, muscle mass, strength, function during weight loss. Whereas fiber can also help with that satiety piece, help with digestion, blood sugar control, and also supporting the gut microbiome. So synergistically, they do have beneficial properties. I do believe that there are certain spaces in the social media world that have focused on weight loss, insulin resistance, diabetes, PCOS, which is now called PMOS, and then also GLP-1s that have shaped people's interest in fibermaxxing and increasing their dietary protein intake. What is encouraging is that these trends are suggesting that this shift helps with body composition and also metabolic health. Whereas 5 years ago, the dominant conversation would have been like, how do I lose 20 pounds? Whereas now it's like, how do I lose weight without losing muscle? So it's more of a body recomposition, a position that we're looking at. Also, people are looking at, how do I stay full without affecting my gut health? So these are positive conversations that are now happening that wasn't happening a couple of years ago. But I mean, I think the main challenge with what I am seeing on social media is, turning good principles into extremes. So, how do I get enough protein, or, how do I eat 200 grams of, protein a day? It's some of these things are not sustainable, in my opinion. And I also do think that long-term wise, if you're eating 200 grams of protein and you're not eating enough carbohydrates and fats, that's going to affect your hormone health as well. That's going to affect your energy levels. So there is a balance with everything. And so when you are going quite extreme, it can affect your overall health as well. And then in terms of fiber, I mean, chasing 80 to 100 grams of, fiber a day also isn't good for your digestive health. I do think that there is a good balance. So, although I do think that social media has helped kind of educate people on the right path, I do think that these extremes can cause some detrimental effects to people's health if they go too far.
Yeah, and that's a really useful lens to put it and see it through. And it kind of actually connects to something that I think deserves its own moment in this conversation, because alongside the protein and fiber optimization, we're also seeing the opposite happening. So you kind of briefly glossed over it, how this is something that we've seen in the past, how people want to, maximize the amount of weight they're losing and not necessarily putting an emphasis on that. And we actually touched on this on our first episode about GLP-1s, and if you haven't listened to that one yet, I think it's worth a visit. But one thing that's becoming increasingly relevant as these medications become more widespread is the nutritional picture that comes with them. Especially with the popularity within mainstream pop culture and conversations, these trends really kind of do dictate what we're actually seeing in real life. So there's a real population of people who are eating significantly less, sometimes very little. And when overall intake drops that dramatically, it's not just calories, it's also nutrients that are dropping. So things like calcium, key vitamins, micronutrients that just don't get talked about within that weight loss space. So with GLP-1 use on the rise, we're seeing patients whose appetite is dramatically suppressed, sometimes to the point where getting adequate nutrition becomes genuinely difficult for people. Nutrient deficiencies like calcium and protein intake, those are real clinical concerns that can get lost in the weight loss narrative. How do you think about that picture? And does the conversation around fiber and protein shift entirely when someone is eating much less overall?
So, in terms of GLP-1s, I mean, the benefits of GLP-1s is also their main side effects. And like we discussed, we delved into it into the first podcast. So people should definitely listen to that because I did discuss that a little bit more. But I mean, having appetite suppression is one of the benefits, but also the downsides of GLP-1s. And the main thing is that if you're no longer eating enough food, then you're going to have some nutrient density constraint problems. And so trying to fiber max and trying to eat as much protein as possible may not be possible with these medications. So I always try to strive and educate my patients to at least eat the minimum, which I explained earlier on as the 0.8 grams per kilogram a day. With agents like semaglutide or tirzepatide, people often eat fewer meals, or they have smaller portions, or their overall caloric intake is reduced. However, the requirements for the key nutrients that they should be eating on a daily basis shouldn't be reduced because they're on these medications. They should still be eating the amount that they should be so that they can have energy, so that they can be producing their hormones, so that they can keep their muscle mass. And so the risk of having a suboptimal diet can also not only affect the macronutrients, but like you said, micronutrients like calcium can also be affected, which will now affect bone health. You'll see other deficiencies like vitamin D or low iron or low B12. This may also be a factor if they're not eating enough meals per day. Protein in this regards stops being more of a macro optimization trend and becomes more of a muscle preservation intervention. So making sure that they're hitting their daily targets of having that 0.8 grams per kilogram a day is going to be important. The same thing with fiber. Fiber is still important, and some things that you typically see with patients on a GLP-1 is constipation, especially with like delayed gastric emptying. Their digestion is impaired, their gut motility is impaired, they have greater satiety, so they typically are a little bit more constipated. So fiber is still important in that regards, but how you are doing it is going to be quite different. So you're not going to be looking at 80 to 100 grams a day. Once again, you're going to be going back to that minimum amount of fiber that they should be eating, which really and truly an adult should be intaking approximately 25 grams a day. And I mean, I've had my patients, especially my patients on metabolic, health consults, it's quite hard to get to 25 grams a day. So I mean, those that are fiber maxing, I can only imagine how much they're actually putting on their plate when it comes to fiber, because it's quite difficult with a standard American diet or like a modified paleo. It's quite difficult to even get to that minimum. So to get to that maximum, that could be leading to, other GI symptoms. I wouldn't recommend it. I would look at, let's reach that minimum, let's keep you sustained while you're on this medication and while you're having some of these side effects such as appetite suppression.
Yeah, and I think that's a really important reframe for the conversation, because on one end of the spectrum we have all these maxing ideas, but then on the other end we have another quite popular thing happening in pop culture, which is these GLP-1 medications. And so it's not just about optimizing intake for people who are eating normally, it's also about making sure that when people are eating less, what they are eating is actually doing the work it needs to do. Which brings us to how practitioners are navigating all of this within patient day-to-day. So when a patient comes in having done a deep dive on protein or fiber content, tracking macros, following influencers, trying to optimize, how do you approach that conversation? Are you validating it, redirecting it, or kind of building on it?
It's tough. It's definitely tough being a practitioner, and you're almost fighting against like literature, you're fighting against your training, you're fighting against social media. And I do think that the social media bosses are winning. So they typically, their recommendations, people like to follow it more than those that have, the education background. But I don't disregard what they have done. I don't think it is helpful if a patient comes in and you're completely disregarding and dismissing. What I do like to do is I like to ask my patients to come in with the information on, the macros and the micros that they're taking, whether they use like Chronometer or MyFitnessPal. And then I like to see data. I like to see, okay, baseline wise, what have you been doing? What have you been working on? How did you feel, when you started to optimize your fiber or protein intake? And then looking at what sources that they're eating. Are they vegan? Are they having only, pea, plant-based proteins that typically don't have a complete protein profile? Are they having a lot of red meat, or is it chicken? Is it turkey? Is it nuts and seeds? Those are quite important as well. So, that's a whole nother segment, but looking at the sources of what they're eating. The same thing when it comes to fiber. Are you eating fiber that are fruits and vegetables, or are you eating ones that are a little bit more supportive to your gut health, which is like inulin and guar gum, because that can also play a really big role and really big impact. So I do like to ask those questions, especially if they've already done background knowledge on that. And then, I like to just ask them, what are their health goals? Why did you decide to do fibermaxxing? Was it because you were experiencing constipation for a long period of time, or you have a family history of colorectal cancer? So then that way I can kind of work towards their goals, because each and every patient is so different, and how to optimize their health is not the same. So in my opinion, nutrition does play a really big role. There's no one size fit diet. And so with that, I would say I do validate, I do redirect, and I also build on it.
And so it sounds like there's kind of a balance between meeting patients where they are and steering them towards what's actually useful. And I think that's something probably a lot of practitioners are working through right now as well. And it's made a bit more complicated by the fact that the information landscape is genuinely mixed with some of, the good, some of it is incomplete, and some of it is just marketing dressed up as education. So from your perspective, what does the strongest evidence actually support when it comes to both protein and fiber? If you had to cut through the noise completely, what would you tell a practitioner who just wants to know what's worth paying attention to?
Aside from the social media trends, both protein and fiber are consistent with improving overall health. The focus for practitioners should be that they should pay attention to, are their patients reaching the minimum recommended goals? And then what does their other micro and macronutrients look like? So are they eating completely fiber and protein, and they're, no carbs, no fats, or are they having a mixed balanced diet? So they should be looking at that as well. And then also looking at their digestion. I think that that's a really big piece, because if they have gut dysbiosis, if they have low digestive enzymes that don't allow them to break up their protein, then they're also going to have some issues when it comes to even just reaching the minimum amount that they should be eating on a daily basis. And so in summary, I think practitioners should go back to the basics of what are the minimum recommended goals, and then if they have additional health goals, how do you help them get to that place, and then just looking at the full picture of that patient.
So that sounds like a really helpful anchor point to have, and I think it's a reminder that some of the fundamentals in nutrition have been consistent for a long time, and even when the conversation shifts around them. So let's kind of close up now here with something more practical. I know I just asked you about something worth paying attention to, but as we wrap up, if a practitioner is listening to this and they want to start having better conversations with patients about, I think, nutrition in general, not just protein and fiber, kind of not just reacting to the trends that are circulating, instead having a main takeaway. I know we kind of just went over that, but I think just like a baseline key takeaway for nutrition in general that's removed from the trends.
I think the main thing when it comes to nutrition is that how I see is every day you're either getting closer to good health or disease. And so my goal when it comes to nutrition is making sure that you are eating what you can to help prevent any chronic diseases. So whether that is eating the minimum amount of fiber, which is 25 grams a day, so that that can prevent you from having, colorectal cancer or, chronic digestive issues, or having 30 grams of protein a day so that you age well and you maintain muscle mass and you prevent osteoporosis and all of those conditions. Nutrition should be used as a pillar not only to just nourish yourself but to also help prevent long-term ailments as well.
Yeah, and then with that, then Dr. Onah, it's been a really enlightening conversation. I think it's going to be very useful not only for practitioners but people in general as they go about their day-to-days with all this noise around them. And so thank you so much for your time today, and thank you everyone else for listening. And if this episode got you thinking, we'd love to hear from you. But until next time, thank you.